Welcome to my cataract surgery video that is intended for patients to gain more insight into how this is done efficiently and with maximum safety and efficacy. It is one of the most common operations performed in the world and is also a very safe and successful operation with less than 1% chance of any complications. First and foremost, your comfort and safety is paramount, and this operation is being performed with local topical drops anesthesia, but you can opt for injection anesthesia or general anesthesia. The eye is cleaned and draped, and as you can see here, we have put a clamp in the eye to keep the eye open so you can blink with both eyes normally. We usually require you to keep very still during the operation, and the surgeon will be in continuous communication with you with regards to when to keep still and when you can move, but only a little. We make absolutely sure that you have adequate anesthesia and adequate pain relief before the operation starts. If you do feel pain during the operation, there will be a nurse by your side and you can squeeze her hand, who will let the surgeon know to stop and top up your anesthesia during the operation. Now, to discuss the operation, once we have got you all comfortable, the eye is cleaned and draped with a clamp to keep the eye open, and 2 incisions are made, as you've already seen, on the sides of the cornea, and 1 main incision at the edge of the cornea where we can gain access to the capsule. The capsule, as you can see here, is slowly being removed in a circular fashion, and it is important to keep very still during this important step in order to gain access to the cataract. Now what we are doing is that we are passing water around the cataract in order to release it from the bag, and you can see here that this is also a very delicate step, and it is important to get this right in order to try and mobilize the cataract from the lens bag, which we need to keep safe during the operation. The cataract is slowly grooved with high technology ultrasound, and this is done by use of a probe, which is being used here through the main incision in the cornea. And the cataract is split into pieces that are slowly grooved and removed as small pieces, as you can see here, and we're using a second instrument in order to mobilize the cataract and get it to the ultrasound tip, which is eating away the cataract very slowly. Care is taken at this point to ensure that the capsule is not touched, and again, this is the reason why we ask you not to move during this very important step, which can take anything up to about 2 minutes to 5 minutes to remove. Here you can see the cataract is completely removed, and we are just taking away the outer shell of the cataract, and this is coming away very nicely here. Now we are cleaning the leftover remnant cortical matter, which is basically the outer and sticky layer of the cataract, which is very close to the lens bag. Now the lens bag is the most important part because that's where the artificial lens is going to sit, and it is important to preserve this bag as we are doing the operation. Care must be taken not to damage this lens bag, although this can happen in 1 in 1,000 cases, even in the experienced hands, and this risk is ever so slightly higher in glaucoma patients. Though if this occurs, it can be managed systematically to try and give you the best possible outcome, with the lens being placed in a different location at the same time or after a second procedure. Here you can see that the lens is being mounted into the inserter, and we usually warn you at this point that you're going to feel a bit of pressure on the eye, and here you can see the lens is being placed very carefully and slowly into the lens bag with the use of a second instrument here, and all is going very well at this point. The lens that we use is a special lens that is tailored to your visual needs, and here what we are doing is taking out the jelly that we put in to create space for the lens inside the bag, and We ensure that all the jelly is taken out during the operation, although sometimes a little bit of jelly can be left behind, but this is slowly absorbed by the eye. Now we are pressurizing the eye to its normal intraocular pressure, and we are hydrating the wounds and making sure that they're not leaking. You will be given antibiotics, steroids and anesthesia during the operation to keep infection, inflammation and pain respectively away. You will have a pad on the eye over 24 hours and you will be able to relax and rest at home, and will be seen the next day where the pad will be removed and your eye would have healed to a large extent, as you can see here. The eye will heal further over the next 3 to 4 weeks and you will hopefully see the difference in your vision, and as a result of successful surgery, as this patient has done. Thank you for listening.